It's funny, I'm giggling again already because we did a couple of things on prostate massage and we have thousands of views on it. So I know this is a topic of interest and importance.
Did you push record?
Thanks again for joining us on another segment of Our Second Act with Paige and Silka. We're continuing our conversation with Tiffany Yelverton of Entice Me, the founder and chief sexnista, right, Tiffany?
Yes, sexonista.
Sexnista, I always say that wrong. Well, Tiffany is back with us, and today we're talking about the men. What do we as women need to understand about the man's sexual health, especially as it pertains to prostate health?
Well, I think that we always have thought or assumed that male pleasure always comes from the penis and that an ejaculation and orgasm happen at the same time. And that's a simultaneous, like one thing, but it's actually two separate things. And men, it just happens to usually happen together. But men can also have non-ejaculatory orgasms. So if they're having some erectile dysfunction or losing an erection during intercourse, there are other ways that men can experience pleasure, and one of them is through the prostate.
Yeah, it's funny. I'm giggling again already because we did a couple of things on prostate massage and we have thousands of views on it. So I know this is a topic of interest and importance. Men kind of squirm a little bit. Some were enticed, pardon the pun. But I think that, what's important about prostate health, one, is to understand that from a woman's perspective, I'm talking now, that if your husband, your partner, is having trouble with maintaining an erection, that it's not you. You may not be, it may not be that he's not attracted to you, but that is something physiological, and that it's something that this swollen prostate gland. And again, we're not doctors. We're not trying to dispense medical advice. However, that by massaging the prostate, you relieve some of that pressure and can actually prevent prostate cancer. And that's from a doctor who I talked to. Would you agree?
I do agree. So the latest studies have said that for men, 21 ejaculations or orgasms a month cut down on prostate cancer by up to 30%. So when we have prostate massage, the prostate orgasm that comes from that actually clears out more even ejaculate out of the prostate than a typical penile ejaculation. So that's why it's clearing out the fluid even more, and so it's benefiting even more than a typical ejaculation or orgasm.
Okay, so I'm going to ask you a really stupid question.
Sure.
Because if I have it, then other people have it too.
Absolutely.
So when you ejaculate by stimulating the prostate, it ejaculates through the penis. That's what all the fluids you're clear. We're talking about the same fluids.
Yes. But because you're putting pressure there, it's going to, and that organ itself, the prostate, is going to be experiencing its own contractions. It's going to release more ejaculate. And sometimes there's no ejaculate released, but typically if there's a lot of buildup, then more will be released.
Yeah, so when men, or we've joked about, well, he's backed up, he hasn't had sex for so long, he's backed up. That's a real thing too.
And when men age, about 50% of men at 50 have an enlarged prostate, and that just increases about 10% for every 10 years. And so being able to stimulate the prostate, it really does help a lot, and it's very pleasurable. Men report that it's about a 10 times stronger orgasm than a typical orgasm.
Yes. Yeah. So I think everybody knows, but maybe not. Let's just be explicit. I mean, this is talking about anal stimulation.
Anal stimulation through the rectum, and that's how you access the prostate. It's the same in utero. It's the same tissue as the female G-spot. So it is a very pleasure-oriented object.
So, again, it's something that people get squirmy by, and I'm laughing about it again, and and that's okay. It's okay to not be comfortable with it, but the more we talk about it, this actually can be extremely, extremely helpful. So,
Yeah,
anyway, so thank you for talking about it, Tiffany.
absolutely.
Well, and
Always,
now go ahead.
always use lube when you're doing any anal stimulation as well, and cut your fingernails or wear gloves. We could do a whole segment on precautions to take prior to, but it is pleasure and it's a health benefit.
Well, and we should say that you have also, there's products available to do it. It can be a partner thing, you can do it yourself, and then there's products that are available to assist, correct?
Absolutely.
Okay. And I think you have some of those, and we'll link to them as
Yeah, we
well.
definitely.
Tiffany carries great, safe, organic product. Do we call them organic?
I, a lot of them are organic, but medical grade is a good way to put it. Body safe.
Okay, perfect. And now, just to follow up on one other thing you said, if it's 21 ejaculations a month cut down on prostate cancer, is that the stat
Yeah.
you had? So men are, there or women, go, how is he going to ejaculate 21 times a month? What do you say to that?
I would say that most men probably already are, and they're just not telling their partner that they're masturbating that much.
So
I think
even
most men will say that they masturbate once a day at least.
really, so even at our age.
Yeah.
See, that's good to know. Good to know. So yeah, it's a good thing. Masturbation is a good thing because you may cut down on prostate
Yeah.
cancer.
Absolutely.
Oh, that's funny. Well, is there anything else that you'd like to add on this topic?
Doctors, and I'm sure you've had doctors on your show before, but doctors used to do prostate massage to lower BPH, which is the benign hyperplasia, the fluid that's in the prostate. That's the benign fluid before prostate cancer. But now it's just easier and faster to give a pill. So a lot of times they don't do that. But that used to be a typical medical procedure that was done in office.
It's interesting to know. Well, and you know what? When I did some research on this, the treatment, like you said, the pill that can cause
Yeah.
erectile
And
dysfunction even
yeah,
more.
right.
Yeah, interesting. Okay. Well, lots to think about. Again, we will, Tiffany, thanks so much. You're so fun to talk to. If you have questions that, don't be embarrassed. You don't have to post them publicly. Private messenger us. I will link, to Tiffany's information. Give her a call. She has great, over and above the products she carries. Tell us about that briefly. You do coaching?
So I do coaching with individuals and couples, and a lot of times sexual concerns are a big part of my practice because we don't really know if something's wrong with just us or if it's just normal. And so overcoming those and just having someone to talk about things to is really helpful.
Yeah. Well, and at our age, there's a lot to talk about. We have a lot of baggage, or a lot of history.
We have a lot of
Yeah, a lot
history.
of history, and lots of us are starting over. So this is a good time and a good conversation to have. So thank you again for joining us, and we'll see you soon on another episode of Our Second Act with Paige and Silka. Bye bye. Thanks so much for joining us today, and I hope you found this information helpful. If you haven't already done so, please just take 1 second and subscribe to our channel. Button's right over here. And for more about living your life to the fullest after 50, please visit our website, secondact.tv. See you soon.